Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everybody to this live broadcast on Instagram and a recording on YouTube. This was planned to be done on YouTube, but unfortunately YouTube says I'm not eligible to do a live streaming yet. Maybe because I have an Android device, I don't know. I'll find out more, and inshallah we'll be doing live broadcasts on YouTube later on as well. So now, this video is going to be possibly the realest video, like the most real video I have created so far, and it's going to discuss real problems, real issues, and how we will solve them together in the workplace, inshallah. So, in the workplace, the company basically, if it's a small company and it's battling to get a contract and all of that, they will submit a really, really great tender, say, yes, we are good with safety, we will do this, we will do that. So the client will select them, and when they come to the workplace, you find out that they're coming to the workplace with slippers, and they're not wearing full PPE. That's like the basic requirement for being on the site. Okay, on paper they have a great health and safety policy, amazing, but when it comes to implementing that policy, it's like they haven't even heard of it. You come to the supervisor, you come to the foreman, you come to the site manager, and you ask them about health and safety. They said, look man, I've been with this company for 20 years and it's always been one focus: production. So this is a real issue here. What you have to do now is educate the people, educate management on health and safety culture and how they have to implement it from the top. Okay, because it's like cleaning stairs. When you're washing stairs, when you're washing steps, you have to start from the top. Okay, when you start from the top, it's going to be clean, then clean. If you start from the bottom at a worker level, the first step, if you start at the worker level and then you go to the higher up, what's going to happen? It's going to be dirty. No, we have to start from the top management. Welcome guys, welcome everybody. So we have to start from the highest level we have on site, and that is the site manager. Okay? What do you have to do now as a client HSE representative or as their own health and safety representative? You are just hired into this company and they have a poor health and safety culture. So let's say two examples here. Let's say two examples. One is a company that you worked with before and they have good health and safety culture in place. The manager, before the supervisor and the foreman and the team leader and the team members, they follow health and safety rules and regulations, and they encourage others to do so. So now health and safety is a way of life, actually, in that work site where you were before. But now you came to this work site, the second example, and management, supervision, foreman, driller, assistant driller, whatever have you, engineer, or whoever is in charge there, they don't care about health and safety. They have a schedule. They want to make sure that the work is done so the client doesn't yell at them. Why? Because if the client starts talking bad about them, management is going to talk bad about him, the engineer or the site manager, and he will lose his job. So what they do is they ignore health and safety and they focus on the job only because they don't want to be fired. So what you have to do now is you have to focus on production so you don't get fired. Because if the management is willing to fire the site manager, of course they will fire the safety person. Okay, why is this safety guy always asking questions? Why is he always stopping the work? Fire him. Bring somebody that will listen to management. Bring somebody that will follow the safety, that will follow the management and only say yes. That's the kind of safety we want. But that is not the safety safety guy that I am. Okay? What I want to do, I want to follow a system that I believe in. Okay? I want to convert this work site, this workplace, from bad to good. And how do I do that? I go to them individually. You can start from the low level or the high level. I recommend starting at the high level. Why? Because if an accident happens, what's going to happen now is top management is going to be in big trouble, and they will talk bad about the site management and all of that. They all know there's no health and safety. They all know there's only production. They all know that. Okay? But when an accident happens, when the enforcement agencies come or the police get involved, when somebody is hurt, yes. When the police come and the enforcement agencies come and everything, top management is going to say, oh, we have a good health and safety management system in place. We have it. It's right here. See, we have it. And it is the site management fault. They did not follow the rules, but we have good reports. We have everything. When actually, you don't. Because plan, do, check, act, right? You should plan your work. You should check it. You should do the plan. You should check the plan if it's working, and then you act if it's not productive. So, as management, you have to make sure that health and safety is number one in the workplace. When you have good health and safety, you will have production. When you don't have production, when you don't have health and safety, you will have accidents, and nobody wants that. That is bad business. It's bad for business. So, how to deal with this issue? Let's say you are a low-level HSE officer or safety man. Okay, you're on the side. You tell the people, "Come on, guys, use your glasses. Come on." Look at this guy. Look at glasses. My manager is not wearing glasses. You want me to wear glasses? What kind of logic is that? If you are a man, go talk to my manager first. Have him put on the glasses, and then I will wear glasses. How about that? So, thank you guys. Thank you. So, when you are talking to them, and they talk to you like that, you feel bad in your heart. You feel bad. Okay? The camera is reversed. So maybe I'm pointing at the wrong section to you, but actually this is my left side. So you feel bad. You say, he is right. Why am I talking to the worker to put on his glasses when his manager is walking in front of me and in front of him and everybody else and not wearing glasses? I say, no, I cannot talk to him, man. Come on, he will fire me. That is wrong. That is wrong. You are HSE. You are HSE. When something happens, everybody's going to say, where was the HSE? Where was the safety man? What was he doing? Was he on a coffee break? Was he smoking? Don't be that guy. So start from the top. The highest level you have on site is the site manager. Talk to him during lunch. Talk to him when you're sitting together in the break. Sir, this is really, really, really not acceptable. I don't care about management, high management. I'm talking about you and I, right here. We're two guys. You are the site manager. I'm the HSE guy. I can stop your work. No problem. I can stop it just like that. But you will call your manager is going to call my manager, and my manager is going to call me. Hey, why did you stop the work? Production is important. This is very, very sad. If my own HSE manager is going to harass me for doing the right thing and for wanting to, wanting people to follow safety, I need your help. Because you and I, we can make this work. You and I, both. I don't care about my manager. You don't care about your manager. Let's make sure that this site is running productively, and in the same time, we have safety. Okay, how do we do that? I need you to be the leader, sir. You have to follow the rules. Come to the Toolbox talk. Nobody has seen you in 3 months. Nobody knows what the manager is going to say. every topic you have, everything you do, you have to involve safety in it. Okay? Let me just read this. Top management support HSE, everything will be great. Safety culture will improve in the operation. Yes, that is exactly my point. That is what I'm trying to say here. So, sir, please. Did you know that HSE officers are not supposed to conduct the toolbox talks? Did you know that? As an HSE guy, did you know that? The toolbox talk, the pre-job safety meeting, that is not where the HSE guy comes in. That is not our job to conduct the pre-job safety meeting, the toolbox talk. It's not our job. It is our job to make sure that the foreman is doing the toolbox talk. The supervisor is doing the toolbox talk. The site manager is attending there. We are officers, okay? HSE officers. Okay, think of it as the government, okay? You have the legislative committee, okay? And then you have the enforcement agencies, and then you have officers, okay? We are a part of the enforcement agency. That's why they call us HSE officer. We have to enforce the law. We have to make sure the rules are being followed. If not, we have to make a report, send it to management. But again, it's very sad because my manager is also afraid of losing his job, so he will just close his eyes and not follow. So again, it is up to you. It is up to you as a safety officer. As confirmed already. It is up to you as an HSE officer to make sure that the toolbox talks are done. But I've had this actually done with me in one site. I said, sir, you have to come, you have to talk in the toolbox talk and everything. Said, you know what, if I come, I will just say, okay, make sure you do your work fast, take care of each other, focus on this, let's go. The toolbox talk will be 1 minute, and that's it. Just enough for everybody to sign the attendance sheet. Okay? This is very sad. You have to make sure that the toolbox talks are being done. Now, let's get to the heart of the problem. The supervisor and the foreman. You can't talk to him. You cannot talk to him either because his manager is supporting him. His manager is in his back. What are you going to do? Fire me? Report me to my site manager? I am following my site manager's advice. Nobody can touch me. As long as my manager is in my back, I am the star. Why? Because I am productive. I'm bringing production. You, safety guy, what are you doing? What are you bringing to the party? You just stop the work, wear glasses, do this, wear the helmet, do that. You deserve it. As a safety guy, you deserve it. If this is being said to you, if this is being done with you, if this is how you're being treated on the site, you deserve it. Because you allowed it. You enabled them to talk to you that way. Okay? Work on the work site has to be done as a team. And as an HSE guy, I am a part of the team. I'm not going to say I'm the leader of the team. There is no team without HSE. Well, actually, there is no team without HSE. But you have to be a very, very important part of the team. They have to listen to your advice. Not your rules, your commands, your this, your that, be rude. No, you have to be cooperative, you have to be friendly, you have to be approachable, you have to be, you have to have advice when somebody comes to you. Hey, Garib, we're planning on doing this, working at height job. How can we do this job safely? Oh, I'm very glad you asked. Number one, can we do it on the ground? This will eliminate the need to work at height and all of that. Well, no, actually, yeah, we can. Okay, let's do it on the ground then. Okay, that's done. Okay, Jasir, Muhammad, Faraj, Abdullah, Kashif, we want to do this. How can we do this safely? Make them come to you. And how will they do that? By providing good safety advice. Okay? If you don't know about something, Once the day is finished, go back to your room, do some reading, look on websites, learn. Every day, learn the Toolbox talk. Every day. Learn the Toolbox talk and then mention it the next day. This will show the guys that you know what's happening. You know what you're talking about. Follow observations that are handed to you by the good people that follow health and safety rules, and they write observations from the stop cards. From the stop cards, you can make Toolbox talks. Guys, a line of fire, 5 stop cards on the line of fire. What did we say? Then make a Toolbox talk about line of fire. Educate the workers. Educate the supervisor. Educate the foreman. Educate the site manager. And trust me, you will shine. You will shine. So, good health and safety, bad health and safety. I can talk about this for hours, but obviously nobody wants to listen to me talk for hours. Each member of the organization should be as HSE in the worksite. Yes, Ramadan. You are talking about positive health and safety culture, and basically health and safety culture in the workplace. If you want to say it in short, it means the way we do things around here. Okay? Everybody has the right to stop work. Everybody has the right to refuse work if the site is not safe, if the conditions are not safe. Everybody has that. But that's in a positive health and safety culture workplace, not in a negative one. And this was about that. So again, guys, just to recap, get management, site management on your site. Make sure you are one team. Don't break yourself for them. Don't break them to you. Be a team, equal members. Advise supervision, advise the foreman. Have your own meetings with them. Have them be parts of the safety committee, even if it's not official. Just talk about safety. This way, without knowing, they will be advising people to work safely. And in the Toolbox talk, I know it's not our job to do health and safety Toolbox talks or pre-job safety meeting, but when you do that, advise the workers and make sure that they are following your advice and they are doing things correctly. When you're watching them, when you're not watching them, when you're observing their work, make sure that they are doing it safely. Okay? The reason why the supervisor has to do the Toolbox talk is because they know the job better than us. They know the job better than us. They will. Okay, KPI, that is something totally different. KPI, okay, real quick. KPI is key points indicators. Okay, key point indicators. It talks about, man, you took me to a really different mindset. Okay, KPI, key point indicators. Every month you have trends. Okay, you have trends that are, the arrow is going up. So you have many stop cards about line of fire, many stop cards about positive health and safety stop cards, housekeeping. All of these are key point indicators. You have many accidents, you have absence of work, you have many expenditures on the equipment, or you had spent a lot of PPE. All of these are indicators. These are just examples that are related to health and safety. Okay, you spent too much water this month. You purchased, or a lot of people were complaining about the food in the dining facility. There was not enough salad. There is no soap. All of these are indicators. Basically, you have trending and you have lagging. Okay, trending topics is when you have things that are mentioned more than once and they're positive, and it's going to be trending. Trending, it's going to be a good thing. But if they're lagging, there are too many bad things happening, they will also be trending. But when you enter the numbers, actually, they will be lagging. Okay, we can explain this at a later time. Key indicators, inspection, audit, okay. Mock drill, okay. Yeah, all of these are good KPIs. So, guys, Comment on here after I've posted the video. Comment on here or comment on this video on YouTube. What topics should we talk about? Because I'm actually, excuse me, kind of running out of topics. So let me know, guys. What do you? You're welcome. You're welcome. What would you guys like to talk about? If you missed this, if you missed the beginning of this podcast, come over to YouTube and watch the full version. Thank you guys for joining. I appreciate it. And